As statisticians and data analysts, our goal is to support the efforts for those who can take the data and put it in action. What we are going to present at the National Summit is the process that we built here at the University of Kentucky to provide analytical support for the UK healthcare efforts to address, first, the demand for opioid analgesics from UK healthcare patients, and second, to reduce the opioid prescribing from UK healthcare prescribers when possible, without compromising the treatment of patient pain.
I focus on working with prescribers, so that's physicians, dentists, mid-level providers, around how we can optimally prescribe opioids to still address pain while minimizing the associated risks. So this is a study where we actually worked with our state prescribing drug monitoring program database, or KASPER. And so we worked with KASPER to link their information to information from the UK HealthCare electronic medical record. So by linking these two things together, what we can do is we can improve the quality of both data sets.
We were able to establish a data use agreement with the Kentucky Cabinet for Health and Family Services that allowed us to link data for all UK healthcare patients treated between 2017 until December 2020. We have built this impressive analytical data set that allow us to identify the patient pattern of opioid use and co-use with other controlled substances prior to admission and after discharge, and especially time after discharge when the patient care is actually moved from the UK healthcare practitioners to the local community.
So we take this data and we can then, once we know who may be at risk, so whether that's based on why they're interacting with us, the kind of services that they leave from, that sort of thing, we can work with providers in those areas to say, here's a specific group that's higher risk. So we can either look at how we're prescribing medications to them, we can do educational interventions to try to improve their understanding of their risk patterns and such as well. So I used to work in the trauma ICU and the surgical ICU as a clinical pharmacist there. Individuals that come in, they're otherwise largely fairly healthy. They have some kind of traumatic experience and some new interaction with the health system, and all of a sudden now they leave the hospital on 20 new medications with maybe a plan, not always a plan, of how are we going to come off of these medications at some point in the future. So if we can work with well-intentioned providers, with well-intentioned patients, with well-intentioned everybody to try to intervene again upstream, we can hopefully have a profound impact years down the road. There's a perspective of Kentucky in general, an epicenter for the opioid crisis. So I think it's as or more important that we're seen as a critical player as a university, as a state, as a region, kind of lead ourselves back out of this crisis.
And the University of Kentucky researchers and healthcare practitioners have been among the national leaders on treatment of substance use disorders, on developing analytical capacity and public health surveillance to support the treatment, to support the policy and planning. I think we have a lot to offer from the projects that we do and from the experiences that we have to share with our colleagues who could be just at the beginning of this battle with the opioid addiction.